Meantime, Texas hospitals will soon have to start tracking how much they spend on undocumented immigrants after Governor Greg Abbott issued an executive order this afternoon. ABC 13's Luke Jones is live for us in the medical center with the details. Luke?
Yeah, Harris Health, which operates both Bentop and LBJ, said it plans to comply with the new executive order, but right now they're not giving any specifics as to how they plan to do that. Critics say it'll almost certainly involve inquiring about a patient's immigration status, and they're worried that could have a chilling effect. Starting November 1st, your trip to the emergency room could start off with a new question. Are you in the country legally? This newly signed executive order requires hospitals to keep track of how many of its patients are undocumented and how much they're spending on their health care.
I very much believe this is a political move that vilifies our immigrant communities.
Imelda Mejia with the immigrant advocacy group Texas Rising worries the law might make people think twice about seeking treatment.
It's going to throw patients for a loop, I think, and we know that immigrant families already have a hard time navigating our healthcare system.
As noted in the executive order, patients won't be turned away because of their immigration status. The governor argues since the state is paying for the treatment through Medicaid funding, it has a right to try and recoup the cost from the federal government.
It is important to the taxpayers to know how their money is being spent, how much it's costing them, and where that money is going.
The law requires hospitals to make quarterly reports to the state's Health and Human Services Commission starting March 1st. Florida enacted a similar law and reports they're spending $148 million a year in health care for undocumented immigrants. While hospitals can ask about immigration status, legal experts say you're not required to answer.
Even if people don't say if they're in the country illegally, you can make a reasonable deduction here. People don't have valid ID.
The executive order doesn't spell out if that's an acceptable way of gathering this data.